Welcome, my name's Anthony Lucas and today our topic is obstructive sleep apnea. To tell us more, we're joined by registered psychologist and Sleep Health Foundation board member, Dr. Moira Junge. Dr. Moira has over 25 years experience in the healthcare sector and has worked in the sleep disorders field since 1994. Dr. Moira, thanks so much for joining us today. I'm really excited to talk about this topic.
My pleasure, great to be here.
So what is obstructive sleep apnea?
Well, it's a very common condition. It affects mostly males, but some females as well. And it's a condition that the word apnea means absence of breathing. So it actually means that there's an obstruction in your airway during your sleep and you stop breathing for any period of time. Sometimes it's just 10 seconds, sometimes it might be up to a minute of stopping breathing. And this can happen several times per hour, so several times over the night. And when someone does have obstructive sleep apnea, they have they're very debilitated. They feel excessively sleepy throughout the day. That puts them at great risk of mostly car accidents or other accidents at work.
Wow.
They'll have, so the actual, we call it EDS, like excessive daytime sleepiness.
Yep.
That's the biggest feature of obstructive sleep apnea.
Wow.
So the person also, mostly they're a snorer, mostly they're a very loud snorer, and they'll have that snoring, and then the period of absence of breathing, the apnea, and as they're waking up again, there's a choking sound. People might have, you'll know that if you have it yourself or your bed partner
has it. You can actually hear it.
You can hear the person sort of choking and gasping as they start to breathe again.
Wow.
So all of us have a little bit of degree of sleep apnea, like even up to 5 times per hour. It's called this, they've got an index called the apnea hypopnea index. So there's apneas or hypopneas, which is actually, you just have reduced breathing, not complete absence of breathing. So that AHI index, the apnea hypopnea index, that can happen up to 5 times per hour and you're considered normal on the sleep study. But if you're above 5 and up to about 15 times per hour, you're considered sort of mild and moderate, and then so on and so forth. It goes right up to, if you're around 30 times per hour, obviously that's every second minute, you're very severe.
Wow.
And so it's a really big problem. And I think when we first started, like when I was back in 1994 working at the Alfred Hospital, at the Sleep Disorder Centre then, the vast majority of what we did was screening for sleep apnea. And you really have to have an overnight sleep study to know whether you've got it. The doctors will have a pretty good chance of knowing you've got it by having a good look down your throat. Often people have just a really crowded airway. And as I said, mostly overweight as well. There's a lot of pressure when people lie down. There's a lot of pressure around their neck and on their tummy from excess weight. But it can be a very thin male and it can be a thin or overweight female. But it's just more common in overweight males.
Wow, so how would I know that? I guess you've kind of answered that already, but how would I know if my partner or like a child has it? Would they have to physically kind of assess them? Or?
Yeah, well the biggest, one of the big clues is the snoring. So I think that snoring, it used to be part of our campaign years ago, like even when we first had the Sleep Health Foundation 10 years ago, one of our first things we did was talk a lot about not making snoring a joke anymore, because it sort of becomes a bit of a joke.
Oh, you snore.
Oh yeah, I'm not going to sleep with, on the school camp or on the business trip. I don't want to sleep with so and so. Thinking that snoring was just a joke and you're a bit of a social pariah if you're a snorer. So the biggest thing is just when someone's a snorer, it's very important just to work out, are they just what we call just a simple snorer? Like a social snore, it's no problem, they're just a snorer, they're just annoying to them, their partner, but they're fine. Or is it something that has an associated, very debilitating condition like sleep apnea?
Yeah.
So the snoring's a big one. Then the excessive daytime sleepiness is a big one. Like just really, if someone's really sleepy and they've slept all night, like different to when we're talking about insomnia, it's like this difficulty, you can't really get to sleep or stay asleep. And but obstructive sleep apnea is comes under the heading of like a condition of hypersomnia, where you're feeling sleepy, excessively sleepy during the day, and you have had a normal night's sleep. In fact, a lot of people they think that they're a great sleeper. They don't understand that their excessive sleepiness, like falling asleep in meetings and all that sort of stuff, is not healthy. They think that they're a great sleeper. So it's really important for people to realise that feeling excessively sleepy, falling asleep during the daytime despite having actually had pretty normal looking sleep, you thought it was normal, and you're not long periods of awake that you knew of.
Does obviously before it's obviously diagnosed, if I was to have insomnia, would I know that, like, is there a way that I can actually tell without being tired? Like, can I actually feel it at all?
With obstructive sleep apnea?
Yeah.
Yeah, you will know, you will feel excessively sleepy. You will not know, you may not know that it's to do with your sleep.
Yeah.
That's the difference. You might just think, gee, you probably, mostly males too, they don't necessarily go and talk to the doctor about it. They might just think, oh, this is just, you know, I'm 50 now, or I'm just tired, I'm working hard. So it's really important that they realise that when you are excessively tired, excessively sleepy, maybe even having a few near misses on the road, to talk to the GP about it, and actually have a sleep. Really do need to have a diagnostic overnight.
How do we tell the
study.
difference between just snoring? Is there a difference between just snoring and that sleep?
Yeah,
apnea?
because that's true. Because when they're on the sleep study, the snorer will just because all the things we put on and checking everything, they'll all just be pretty normal. But the only thing going off the scale is the decibel meter of the snoring is problematic. But just in terms of it's loud. But the person who's got obstructive sleep apnea, on all the data we look at with this overnight sleep study, they will show there'll be flat lines there'll be all sorts of other restlessness. There'll be all these wakings, like the brain is, you know, it's like someone's flicking their brain, like, you know, 30 times per hour waking up. Like, it's absolutely dreadful looking sleep, like really awful. But the person wakes up and says, yeah, I slept all night. They have no recollection. Most of them don't recall that they've had that terrible sleep. Yeah. So it's a lot of education. So obstructive sleep apnea, the main reason we want to talk about it as much as possible, and people like the Sleep Health Foundation and the Australasian Sleep Association, you know, we do webinars and we do things like this, and we want people to be very aware that it is a dangerous condition if it's untreated.
When you say dangerous, what do you mean there? I know you've said, like, obviously, for instance, in a car, but can you elaborate a little bit on that?
Yeah, because it can be dangerous as in it's related to can lead to other health conditions. So if it's untreated for a long time, you are at more risk of, unfortunately, you know, some cardiovascular conditions, stroke, some dementias. There's clear associations with untreated sleep apnea and what it can do to you long term. It's very damaging to the brain. It's damaging to our, you know, internal cardiovascular system. It can also be associated with depression. So people can feel just pretty low and pretty flat and not know why. So it's pretty nice. No, the good news is that it's very simple to treat. I shouldn't say simple. It's not necessarily
not as complicated.
Because some of the condition, the treatments are available. Most commonly the CPAP machine, it's called continuous positive airways pressure. People who wear a sleep mask at night, they put it over their nose. It's attached.
Well, I guess I was going to ask you about that. What are the treatments?
Yeah, so the treatments are this CPAP machine, which I say easy and simple because if you like it and use it, it's fine. But a lot of people do have trouble using it. So that's another story. But again, that can be worked out. That you can get the right mask. You can get some help with getting it, not feeling claustrophobic, etc.
Does that mask get disruptive to people's sleep even more though?
Not really. I mean, not overall. It's a great idea to persevere. Like, you know, even if it's a bit uncomfortable, it's much better than having that other profile. Because if you're being given a CPAP mask to use, it's only because your indices were very high. Like you're excessively sleepy, and you've got some risk. The risks to your health are so great that it's worth putting up with that discomfort of the machine, and it's a pretty unsexy looking thing, but it's worth it, and people really need to buy into that. But if they can't, there's some people they can't, or they're not as severe. The other treatments can be a mandibular advancement splint. So you have this little splint, and it pulls your jaw forward, so your mandibula comes forward, and it opens up the airway. So when you're lying at night and the airway might collapse, the splint has brought everything so forward that there's no occlusion anymore to the airway, and you actually get much better sleep because you're not having this, the airway collapsing, every minute or so during the night. So that's really important. Some people can have surgery. Surgery is another option for clearing out, I wouldn't know as a psychologist all about the anatomy and physiology of the surgery, but know that is one of the treatments. Sometimes people losing weight can be a really good thing. Like just, significant weight loss can really change the pressure around the neck and the abdomen for sleeping at night. That can be...
Kind of leads me to another question that I have. You said before, even skinny people, for instance, can get sleep apnea.
Yeah.
Is there a specific weight that is the perfect weight?
No, it's not really. It's not to do with how much weight you are carrying or not carrying. It's a bit genetic. There's a genetic predisposition sometimes in just the way that the structure of your neck and airway.
Yep.
So interestingly too, which I was talking about, like mostly adult males, but then females as well. Children and babies, it's not uncommon for children and babies to have sleep apnea, and that's often to do with just enlarged tonsils. So again, that their airway is very crowded, and they are snoring and they're snuffling, they're struggling to sleep, struggling to breathe throughout the night, and have lots of apnea.
What are the treatments for people like babies?
Yeah, the babies. It's often sometimes. Well, I'm not sure. I don't have to say clear. I don't work in the neonatal or with babies or little young children. But I do know, partly because I'm very big on this, public education around sleep apnea, that taking their tonsils out, getting the tonsils out is often a common way of actually really improving, like the sleep apnea goes away, and their concentration in class and their grades and everything, and their happiness goes through the roof. So sometimes kids, and like parents and teachers watching this should be thinking about the little kid in the classroom who's really they seem very tired, they seem that they're restless and they're not concentrating, they're just maybe a bit disruptive, could even be a little bit naughty. So I think it's really important when you start going down the line of what's going on with this kid, one of the big questions to ask is, how's their sleep? Ask the parents, what's their sleep like? Are they noisy at night? Starting to get a sense of maybe this kid's got obstructive sleep apnea.
Wow. And
it could be reasonably easily fixed.
So a kid that might be very hyperactive can actually have sleep apnea.
Absolutely.
Do you find that, like within children, do you find that it's treated pretty quickly?
Oh yeah, if they're taken to the right place, that's treated quickly and treated really well. Like in Australia, we've got world class paediatric doctors and nurses and scientists working on this, and they do a fabulous job. And so those kids, particularly the kids who sometimes they might be struggling with their learning, and after their sleep apnea is treated, they're back to normal. They're reading and they're writing, and their social interactions are back to pretty normal. So it's a massive relief for all involved. When sometimes it's just really about being aware, because if we don't keep this conversation going about sleep and about sleep apnea and what it is and how do we know, and all these questions you're asking me, how are we ever going to get to the bottom of it and get people properly treated? Yeah,
well, I guess if they aren't treated, are there any dangers? Like, what are the dangers surrounded to those that don't get treatment for their sleep apnea?
Well, the biggest risk, I think, not so much the children won't, have a heart attack and but an older person who hasn't had their sleep apnea treated or they were unaware of it. Yeah, they are just at greater risk of developing other chronic health conditions as I outlined before.
Could they become quite, I suppose, if it's not like the dangers I'm talking about, quite severe and even deadly?
Yeah. It's actually a killer. So that's where we use the campaign is that snoring can kill, in that, because you've got to make sure the snoring is not obstructive sleep apnea. And I think that road safety messages, we do a lot of, there's obviously road safety messages around speeding, seatbelts and drink driving, drug driving. Wow. But that driving while sleepy, it's a very hard one, because you can't get pulled, at this stage at least, you can't get pulled over for the breathalyzer for how sleepy you are. Yeah. But that's coming. I think there's technology to look at just what's already there around your blinking of your eyes and how sleepy you are. So, but just the main message around that sleepiness and driving is that just make sure that the person needs to understand that they might have obstructive sleep apnea.
Wow. Well, thanks again for joining us, Doctor. It's been an absolute pleasure to have you on. We hope you gained some insight into our topic today. If you'd like to find out more on today's topic, you can head to the Sleep Health Foundation website, sleephealthfoundation.org.au. I'm Anthony Lucas. Take care, and of course, stay healthy.